Okay, well, why don't we get started? Thanks everyone for your patience. My name's Matt. I'm the coordinator of the Leo Panitch School for Socialist Education. This is the Toronto launch, importantly the Toronto launch, because it was launched previously, of Health and Healthcare Inequities, written by Arnel Borras, who's here with us today. So it's a pretty exciting time for many of us. Arnel's a close friend of many of ours and a comrade, so we're really excited to launch this book with many of you. So I think just a couple words on the topic of tonight's event and how we're going to go about this. The topic of healthcare and what leads to the inadequacies and frankly the failures and the chaos of the Canadian healthcare system has been a hot button issue for a long time, I think, since the country has existed, but certainly since the COVID-19 pandemic as well. It's been an issue at the forefront of many minds, and many of us have lost loved ones and suffered because of the inadequacies and inequities in the healthcare system. So I think it's especially relevant for us to look at this, and also in regards to what we're seeing worldwide as well, where we see healthcare workers increasingly under attack explicitly as kind of legitimate targets, not just for things like privatization and cuts, which is sort of the norm now, but also in terms of military targets, as we see most acutely in Gaza, where medical staff and medical facilities are kind of seen as legitimate targets by the Israeli occupation forces. So I think the discussion of healthcare and kind of situating this as not just something that affects people's kind of health and well-being in terms of body and immediate senses, but also in terms, this is also a societal struggle. The struggle for healthcare is also a struggle for many other of the good things in life and for well-being and existence in general. And I think that's something that Arnel lays out in the book quite clearly. So just a couple notes on the event. So the event tonight, as you might know, has been organized by the Leo Panitch School for Socialist Education. We also have been organizing tonight's event with support from the Center for Social Justice, as well as the book's publisher, Fernwood Publishing, which we're very, very grateful to. They've been wonderful. I know they've been very helpful to Arnel in kind of setting the book up, but they've also been wonderful to us in helping getting the event off the ground. So just a word on the school. The Leo Panitch School for Socialist Education was founded in 2023 by members of the Socialist Project, which is an eco-socialist organization based here in Toronto. The school strives to provide radical, accessible, and practical educational programming for those seeking to better understand and address the crisis of our current times. So tonight then, we'll be hearing from Arnel himself, of course, to speak on the book and some of the topics raised by it, I assume, or you could talk about something else, it's up to you. And we'll also be hearing from a number of excellent panelists, including Clarke, Freida here, Wendy and Errol online, who are coming in remotely, and they'll introduce themselves as well once we begin. So without further ado, I'm going to turn it over to Wendy on Zoom, who will kind of kick us off here.
Hello and welcome everyone to this special occasion of the launch of Dr. Arnel Borras's new book, Health and Healthcare Inequities, a critical political economy perspective. My name is Wendy Panagopoulos, and I'm so fortunate to be a colleague who works beside Arnel at the St. FX University Rankin School of Nursing, located in Antigonish, Nova Scotia, in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people who have been here since the beginning. I've built on some of the work of another one of our colleagues, Marie Arnott, who's also close to Arnel, who has gotten to know him through working closely with him in his time here with us. Arnel's professional journey reflects his dedication and adaptability that illuminates to us all who he is, beginning with his family's immigration journey from the Philippines, coming to Canada in 2008. He started working in a factory where he developed perseverance, resilience, and a driven work ethic. He quickly moved into healthcare because of his compassion for people. First as a PCW, and because of his caring, he soon became a registered practical nurse, or LPN here, and then quickly took ownership of his own learning and went on to become a registered nurse while he kept working long-term care in Ontario. His academic journey continued after first obtaining his BA in economics and then a BSc in nursing, initially from the Philippines. Once here in Canada, Arnel completed his honors and bachelor's in nursing from York University. And of course, he was a magna cum laude. I'm not sure if I'm saying that properly, which means with great praise and great distinction. Then he went on to his master's degree in health and then on to his PhD in health, specializing in health policy and equity. And now it's on to the world and presenting in community and at important conferences where his work is gaining traction, especially given the state of geopolitics that we now find ourselves in, this ongoing reality of today's world. I was asked to briefly sort of introduce the essence of Arnel's book and how it's impacted me as a piece of literature in a lived experience of being a nurse for almost 50 years now. I graduated initially in 1976, so next year I will have been a nurse for 50 years, which seems impossible to me, but here we are. I just want to preface my remarks by saying I have had and continue to have the privilege of working with amazing, compassionate, humane people in healthcare over many years, which I'm incredibly thankful for, and especially for our nursing students who continue to inspire and give me hope for a better world after all these years. Mine has been mostly an unplanned journey in nursing, going where my heart took me. And to this day, it still feels upside down, inside out, and backwards most days. It always felt like the closer I was to the reality of the problem, the fewer resources I had to work with. I worked as a community outreach worker for a transition house here in rural Nova Scotia for a time and used to pick up women on the side of the road fleeing from abusive relationships to try to deliver them to a safe transition house. The work was always amazing, but always under-resourced, heartbreaking, and dangerous because there really wasn't any safe place, not then or now. Intimate partner violence is an epidemic here in Nova Scotia and in the world, and one of the biggest public health issues we have, from my perspective, that has only gotten worse with time and all of the inequity and isms that feed it, along with the reality of patriarchy that sustains and fuels it. Arnel's book speaks to this. In my early career, I worked in acute and long-term care, and I finally found a home in addictions in the addictions care field. I loved the work, the people, the clients and families in my care, but I always struggled with the systems, the institution, the rules that didn't make sense to me, the lack of compassion sometimes for the most vulnerable, and for the professionalism it felt like we were all hiding behind at times, the we and the them. The stigma and discrimination. I recently heard someone in healthcare use the words repeat offenders, which I hadn't heard before, for those who require care over and over again. I was shocked, and without the blink of an eye, there was no questioning about why is that happening? Why is it that some of the people who are living and dying on the streets of this country can be homeless, ill, alone, poor, strong, enraged, and terrified all at the same time? The trauma of oppression, poverty, and the violence of silence can make it so. Arnel's book speaks to this. I can remember getting into a huge heated discussion with one of my instructors during my initial diploma nursing program when we did a clinical placement on a secure inpatient psychiatric unit at the Nova Scotia Hospital way back in 1975. I argued with her that they should release all of the patients and lock up most of the staff who were not okay. She listened to me patiently and was a wonderful teacher. Years later, I learned my intuition was somewhat valid, although I also came to realize that I'd come to the work as a wounded healer, given some of my own personal lived experience. That woundedness somehow became the bedrock of my career throughout the years ahead, and I was constantly advocating for what I thought was right, for the care that all people deserved, and for communities to have a voice and to be heard. Arnel's book speaks to this. I wanted to learn more, so I went back to school. I did my nursing degree and then got involved in politics. Not because I was a politician, but because I was a woman, a nurse, and really angry about the way things were. I ran 3 times in 3 years in the late 90s for the NDP at the time, because that was the grounding I believed in and I wanted for people at that time. It was such a privilege to be in people's homes and ask them about what mattered most to them and their families, and I learned a lot. But as the years went on, I came to realize that politics itself, as we know it, may not be able to evolve and disrupt systems enough to make the changes that's required in the quest of health for all peoples. I later went on to do a master's degree in education and learned how to name so many of the things I'd been doing my whole life in order to support and honor people and community. Again, I had some amazing teachers. They were always there for me. They always found me. Joanne Tompkins, who's someone I had in the Master's in Education program, was one of those. Arnel's book has also found me and taught me the underlying language and truths of why and what that is. I can remember being called a communist by a doctor when I was connected to a district health authority in Nova Scotia way back in the early days in 2000, who I think thought it was funny somehow. Little did he know, or maybe he did know, I didn't see the world the same way at all, and I just kept going. The story of inequity, of what matters and who and what doesn't, is etched in communities. Just take a drive around if you can get through the gates and see who lives where and in what conditions. It's right there. Ascribed privilege runs deep. So I will be forever thankful for Arnel's work because it validates 50 years of lived experience in the nursing profession for me. And the knowing that I'm still here, I'm still trying to teach younger and older nurses to be compassionate, to think critically, to get engaged and politicized, and to fight for change. Because it is and it always has been a fight for justice for all, not just for some. Learn to know the truth, follow the money, support those people and communities under threat, and hold your head and heart up. The world needs large doses of concentrated compassion right now. And as my amazing 2 sons have taught me, love burns cleaner than hate. So according to Arnel, and I have a tendency to believe him, we can change this reality, as he so eloquently says. The critical political economy perspective to healthcare inequities views social and health inequities as tangible, interconnected, and subject to change. And now we all have to read his book and live his work and learn how to move these foundations in new directions forward in order to make change. So thank you, Arnel, for all your incredible work and all the humanity and love that has gone into this book. I think it does have the capacity to change the world. I can only hope I live to see it. God bless me.
Thank you, Wendy. That was wonderful. So now we're going to turn it over to Errol Sharpe before we hear from Arnel himself. Errol, go for it when you're ready.
Hello, here you are. The first thing I want to say is I want to just express my gratitude to Arnel for the work that he did on this book, and for it's wonderful to work with somebody that you can have a dialogue and a discussion with, and that starts to and what the end product is something that you work together on. And Arnel was a particular author that I was able to do that with. We later became friends. Arnel has been at our house for dinner. And, Arnel, I just kind of love you because of who you are. So I just wanted to say that before we start. I also want to I think this is going to be a little bit reflective because I was thinking about healthcare and all the issues that we have around healthcare today and all the issues that are raised by Arnel in the book, et cetera, et cetera. When the first healthcare legislation was passed by the federal government uh, in 1957 by none other than John Diefenbaker. Of course, we should note that John Diefenbaker was a part of the progressive conservatives, not just the conservatives. And so he had some progressive bones in his body. At that time, I was 17 years of age, and while this was a cost sharing program, we still had to pay into it if we had to get medical attention, et cetera, et cetera. And it probably wasn't until, I don't know the total history of this, but till 1966 that we actually got, what we call today free healthcare. And in that period of time, um, if children had to be awful sick before their parents would take them to a doctor because they had to pay for it. When I was 9 years of age, I contacted rheumatic fever. I used to call it romantic fever. And, my parents, it was very bad at the beginning. I was very weak. I was sick and a whole bunch of stuff was happening. But then that kind of cleared up a little and it got a little bit better. And my parents said, okay, well, I guess everything's fine. We won't go to the doctor. I think it was about 5 months later, my father had to go to the hospital for something and he was telling the doctor about me. And the doctor said, I would like to see him. So they took me in to see the doctor, and he determined that I had rheumatic fever, which of course was a little bit more serious than a head cold. But at that point in the game, we had to pay for everything. And there was a great tendency among people to only go to the doctor when it was absolutely necessary. And so a lot of people died because they didn't go to the doctor when they should have gone to the doctor. You know. Now, the thing that I wanted to reflect on that is that because in a certain sense we've gone through a period, a kind of historical period in the healthcare system. We've kind of come from that position where there was no healthcare and you had to pay for it all yourself, to a system where it was widely available. And the federal government had provided a large amount of funds to the provinces to support the program. They've since cut that in about half. So the programs have been weakened. And so the way I see it and the way I see what's happening, what has been happening in the healthcare system, we're slowly moving back to where I was as a young person living in rural Prince Edward Island. And I think Arnel's book uh, helps us to understand what needs to happen in order for that trend in that direction not to continue and not to accelerate. But and in the description in the back of the book, it says, what sets this book apart is its explicit argument that capitalism, intricately imbibed with neocolonialism, racism, and sexism, is the fundamental driver of healthcare and healthcare inequalities. So, what do we do about that? Well, one of the things that we've done, and one of the things that Arnel covers very explicitly and carefully in the book, is we fought to have things changed. We fought for reform, or we fought to maintain some of the benefits that we'd already received out of another era. And we fight for these reforms. And this is something I've talked to a lot of people about, kind of in private conversations. It's the first time I've ever said it publicly. But what are these things we fight for? Am I gone? Hello?
Hello.
Oh, I've lost. Oh, here. I had lost my video there for a minute. Um, the things that we fight for, and we often, and if you look at the era of kind of Keynesian welfarism in the 60s and 70s, who got credit for it? The NDP got credit for it. They were not the people that should have got credit for it. The people got the credit for it, for fighting for it and allowing this to happen. What we need to start to imagine, instead of thanking governments and thinking they've been beneficial and helpful to us, to think that these are the things that we organized and fought for and forced the government to give to us. And these are the elements, and these are the bits and pieces, and these are the things that we need to consider when we're looking at the alternative society that Arnel talks about. So that's basically what I had to say tonight. I had a whole bunch of notes here, but I kind of got out of whack. There was one of the things that there's a quote here from Arnel. He said he was talking about the needs. He said their goal is to meet public needs rather than the private desires of economic and political elites. What would happen if our thinking and our organizational, our administrative structures, and all of the things that now serve the interests of profit and the accumulation of capital were reorganized in such a way that they met these needs?
Mm.
And that's what we have to think about. We're not going to change the governments we have, except in a kind of a, every now and again they'll change because they have to politically, for political reasons or whatever those reasons happen to be. But they're doing it for their reasons, not for our reasons.
Mm.
And we got to understand that, and we got to put that concept into an idea of how we build a new society. Thank you for listening to that diatribe.
Thanks, Errol. That was excellent. Thank you so much. Okay, thanks everyone. So we're going to continue now, and we're going to hear from Arnel himself. Arnel?
Good evening, everyone. Thank you so much for being here, whether in person or virtually, as we celebrate the launch of Health and Healthcare Inequities, a critical political economy perspective. This book is more than an academic exploration. It is a lens for examining the fundamental causes of unequal health outcomes. While book launches often focus on the author, this book is not just about me. It is about all of us. It reflects our shared commitment to social justice, health equity, and the conviction that well-being should never be determined by class, race, indigeneity, gender, ability, or geography. The writing a book is often described as a solitary journey, endless hours, many revisions, and moments of doubt. A work like this is never born in isolation. It is shaped by conversations, lived experiences, and the wisdom, struggle, and perseverance of so many who inspired me to think critically and act boldly. This book is not simply a critique. It is a call to action. It rejects the idea that health inequities are more than are mere accidents or unfortunate policy oversights. Instead, It confronts the reality that these inequities are deeply embedded in capitalist structures and that achieving health justice requires more than incremental reform. It demands systemic transformation. Tonight is not just about theory or empirical data. It is about people. It is about the workers and communities whose struggles are at the heart of this book, and about the friends and colleagues who have shaped these ideas. Most of all, it is about you. Your engagement and your action are what give these ideas real power. So as we gather tonight, let's celebrate not just the book, but the collective vision and solidarity that drive us toward a world where health is a right, not a privilege. Thank you for being part of this journey. My deepest gratitude to my dissertation supervisor, Dr. Dennis Raphael, to Fernwood Publishing, especially Errol Sharpe, for believing in this work. Thank you to the whole team, Art, Brenda, Debbie, Lauren, Enumeha, and Beverly, for your dedication and support. Your commitment to, and I quote, critical books for critical thinkers, unquote, make space for voices that challenge, disrupt, and inspire change. Every book has an origin story. For me, this one began with a pressing question. Why do health inequities persist, despite decades of research, policies, and interventions? I wanted to do more than analyze inequities. I wanted to name the systems that create them. Too often, health inequities are presented as natural outcomes, or as the result of individual choices or bad luck. But the truth is, these inequities are produced not by accident, but by economic and political systems designed to benefit a few at the expense of the many. Canada prides itself on its universal healthcare, yet access and outcomes are still heavily shaped by class, race, and other social locations. Why do these contradictions persist in a wealthy country? That's the question that shaped this book. Beyond academic inquiry, my writing was deeply influenced by personal experiences. I grew up inspired by the Philippines' national hero, Dr. Jose Rizal, whose novels sparked a revolution against Spanish colonial rule. Rizal believed writing itself could be an act of resistance, that words could be weapons. So I often told my closest friends, just one book, maybe two, and I'll be content. That dream, shaped by years of struggle, is now a reality. This book is also shaped by profound loss. Friends who were tortured, politically assassinated, or forcibly disappeared. Those denied education because of poverty. Countless people whose wisdom and potential were undervalued and constrained by economic conditions they never chose. Their loss is a constant reminder of ongoing injustice and the responsibility we all share in fighting it. My own journey has also been about survival. I remember scavenging furniture during freezing winters in Mississauga. My study table, a daily reminder of persistence and hardship. I remember holding my eldest daughter, watching as hypothermia set in after she and her mother walked 1.5 kilometers through a snowstorm to get medicine for her siblings because public transit was scarce. I remember lining up at food banks, swallowing my pride because our wages, $8.50 and $8 per hour, were never enough for a decent and healthy life. I remember wondering why my partner earned 50 cents less per hour than I did, while enduring the same unsafe factory conditions. I endured long hours in warehouses repacking soda cans, standing for hours, controlling my bladder as the conveyor belt sped up. Survivors wrote, "You rock," on the board when we exceeded targets. But what had really changed was the pace of work and the pressure on our bodies. So in small ways, we resisted. We slowed down, a quiet act of defiance. When my partner and I were promoted, we moved to a room repacking chocolates and gummies, dressed in white gowns. We joked we had finally become nurses. But beneath the humor was the hard reality of de-skilling, the systemic devaluation of migrant and immigrant labor. Highly trained doctors became taxi drivers. Nurses and teachers became nannies. This was not just economic displacement, but exploitation, oppression that took a toll on our well-being. As an internationally educated nurse, I had to redo my nursing degree at Clarke University. However, despite the prestige of Western education, much of what I learned was not new. But in the Philippines, my nursing education exposed me to a wide range of fields: community health nursing in slum areas and remote villages, mental health institutions, facilities for infectious and tropical diseases, orthopedic and surgical units, maternity hospitals, where I experienced both the joy of birth and the pain of delivering babies born into poverty. In Canada, however, I had to fight just to secure a clinical practicum in community and public health nursing, a field often sidelined in favor of the outdated view that the best nurses belong in hospitals. My practicum at Regent Park Community Health Center here in Toronto exposed me to the realities of homelessness, poverty, and systemic inequities in ways no textbook ever could. It cemented my understanding that health is never just about medicine. It is about power, politics, policy, and the structures that determine who gets care and who does not. Later, working in long-term care, I saw chronic understaffing lead to poor health outcomes for residents and burnout and exploitation for workers. I wasn't just a night shift nurse supervisor for 3 registered staff and 7 personal support workers caring for 192 residents. I was a security guard, a housekeeper, and even a plumber when toilets overflowed. When I pushed for better staffing and working conditions, I became a target. That was when I realized I couldn't change the system from within alone. I needed to step back to rethink the fight, not just to survive, but to reclaim my sanity and my humanity. Through research, I explored homelessness, housing insecurity, food insecurity, and inequities in health and care. But these were never abstract concepts or cold statistics. They were lived struggles, and I know they are the reality for countless other workers, migrants, parents, children, and community members worldwide. Along this journey, I realized I was not alone. Across disciplines and movements, scholars, advocates, activists, and frontline workers are fighting for better working, living, and health conditions. This book is a part of that ongoing collective struggle. This book traces its roots to my doctoral dissertation at Clarke University titled Tackling Health Inequalities Through Public Policy Actions, Insights from Canadian Policy Academics, Activists, and Advocates, published in December 2022. From the beginning, I wanted this work to reach beyond academic circles, to speak to those directly impacted by health and socioeconomic inequities. The journey began with a simple pitch to Professor Henry Veltmeyer, series editor of Fernwood's Critical Development Studies, and Errol Sharpe at Fernwood Publishing. As with any book, there were feedback and revisions. I finally signed the contract while attending the launch of International Journal of Social Determinants of Health and Services in Barcelona on May 19, 2023. But writing this book was not easy. It traveled with me from Mississauga to Barcelona, from Toronto to Bangkok, from Manila to Halifax and Antigonish, finding its place between teaching, research, service, and everyday life. There were days and nights of doubt, moments when I wondered if I should keep going, yet thinking of my family, friends, comrades, and the workers and communities experiencing poverty and injustice gave me the determination to continue. This book was shaped not only by moments of clarity and laughter, but also by sorrow, loneliness, and anger when confronting the harsh realities of health injustice. Through it all, I held on to the advice of my mentors, especially Dennis and Errol. Say it. Think about your experiences. Don't apologize. Don't be afraid of critiques. So here it is, my contribution to the struggle for social justice and health equity. This is not the final word, but an invitation to enrich the conversation, challenge the status quo, and collectively build a future where health is a collective endeavor and not individual privilege. What this book is about. This book examines why health inequities persist in Canada and other wealthy nations, even after decades of research and policy efforts. These inequities, preventable inequalities in health outcomes, are not accidents. They result from societal systems that prioritize profit over people's well-being. Health is political. It is shaped by government policy, corporate interest, and economic structures that systematically benefit the capitalist class while marginalizing workers and historically subordinated groups. Through a critical political economy lens, I analyzed Canada's health system, which, despite its global reputation for fairness, continues to reproduce stark inequities. Drawing on historical analysis, policy evaluation, and interviews with Canadian scholars and activists, this book exposes how the concentration of wealth and power in the hands of the few fuels health inequities. It challenges us to move beyond surface explanations and confront the root causes of inequality. Key themes include the role of capitalism in structuring health inequalities, the influence of big capital and neoliberal policies on housing, working conditions, and access to care, privatization and the erosion of public health care, the power of activism and workers' movements in pushing for health justice. Spanning 8 chapters, the book moves from theoretical foundations to real-world case studies, drawing comparisons from Canada, the United States, the United Kingdom, Australia, and beyond. The disparities are stark. The richest Canadians now live significantly longer than the poorest, while residents of Nunavut die nearly 10 years earlier than the national average. Homelessness shortens life expectancy by 24 years for men and 42 years for women in Canada. This is social murder. Homelessness is not just an economic issue, but a profound injustice against humanity. These realities expose the limits of Canada's so-called universal healthcare system. The final chapters argue that only socialist-oriented policies, such as the expansion of public healthcare, investment in socialized housing, improved working conditions, and massive decentralization and democratization of the economy and politics can truly address health inequities. I am inspired by the late Leo Panitch, whose insights profoundly shaped this work, as he stated, and I quote, In one word, the answer to your question is capitalism. The fundamental parameters of inequalities in a country like Canada are given by capitalist social relations and the requirements of reproducing favorable conditions for capital accumulation. Government policy can modify, ameliorate, or exacerbate these inequalities, but it operates within a system that prioritizes wealth over people's health. Unquote. But this book is more than a critique. It is a call to action. If we are serious about health justice, incremental reforms are not enough. We need systemic change. Nursing and medicine too must move beyond bedside care. Understanding economic, political, cultural, and institutional forces is essential. With this perspective, nurses and healthcare workers can address the root causes of health inequities and become advocates for a just health system. Nurses and health workers embody empowered care when they advocate for meaningful policies, amplify marginalized voices, and challenge injustice. As my professor Adeline Falk-Raphael reminds us, this political stance is central to the health profession and to our collective pursuit for social justice and health equity. Why this book matters now? Health inequities are widening in Canada and around the world. We are at a pivotal moment. Economic crisis, political turmoil, cultural divides, ecological destruction, imperialist-driven wars, genocide, and pandemics are deepening inequities in health and well-being. The COVID-19 pandemic exposed and worsened structural inequalities, especially for working class, racialized, and marginalized communities. Despite promises by government to build back better, we continue to see austerity, funding cuts, and privatization leading to understaffed facilities, delayed care, and overburdened health workers. Housing crisis, food insecurity, and rising homelessness persist. Authoritarian right-wing populism threatens research, suppresses evidence-based policy, and further marginalizes vulnerable groups. In the United States, research on race, gender, and health equity is being defunded, while in Canada, corporate interest and influence threatens the integrity of public health care. This book confronts these urgent realities. While incremental reforms may provide short-term relief, they are not enough. They should be stepping stones to bolder systemic change. True transformation requires putting people, communities, and the planet at the heart of public policy, not profit and capital accumulation. The stakes are high. We must move beyond diagnosing crisis to building real alternatives. This book offers a roadmap for health workers, nurses, scholars, activists, and communities to organize for social justice and mobilize for health equity. A society where well-being takes precedence over health. As Arundhati Roy said, another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. So I say to you all, together, friends, colleagues, comrades, brothers, and sisters, onward and upward. Let's build a world free from exploitation and oppression. Let's collectively fight for a healthier, more just society for all. Onwards towards justice, health equity, and liberation for ourselves and future generations. The time for action is not tomorrow. It is now. In struggle, solidarity, and hope. Thank you.
Thanks, Arnel. That was excellent.
Stirring.
That was stirring, yeah. If we had known that we didn't need the mic, we could have started 10 minutes earlier. Well, I'm not sure how the two of you are going to follow that up, to be totally honest, but I do have faith in you. So next up, we might turn it over to John Clarke for some reflections.
If Arnel did without the mic, I must rise to the challenge and try and say myself. I must say that as I started to read this book, I didn't get too far into it before I realised that it was a very valuable and important book, and one that really, I think, the term call to action was used, and that's what I found so compelling about it. I was, for some 28 years, an organiser with the Ontario Coalition Against Poverty, and so based on those experiences, there's a couple of things I think I can confirm that the book puts forward. First of all, obviously, the link between poverty and health outcomes is so abundantly clear. When we have an event in which we look back over the years of OCAP, the number of people whose photographs we realise those people are no longer with us because they died well before their time is absolutely unbelievable. And clearly that link is a livid one. The healthcare system itself is tainted by the inequalities and the injustices that are referred to in the book. I think of a hospital in Toronto where unhoused people have a particular fear and dread of the security guards at that hospital. That says something pretty compelling about the problems of this society, but how they've actually crept into the healthcare system itself. It is obvious and apparent. The pandemic brought this home with particular clarity, but it is obvious that reduced health outcomes, premature death, illness, all run along the fault lines in this society that are created by social, by gender and by racial inequality. And in Canada, the legacy of colonialism absolutely casts a shadow over the healthcare system to an incredible degree, and all those things are true. But the other thing I want to say about the book was the frank disdain for the capitalist system that is expressed in the book is, I think, a profoundly healthy element of what the book is about, because I think that is so much the missing piece. There are lots and lots of studies and lot of works that will skirt around the issue and sort of point to inequalities and injustices, but they don't really name the beast, and they certainly don't analyse the beast in the way that this book does, and that makes it an incredibly valuable thing. Because as Arnel's book makes so clear, is that what we are dealing with here is a work in progress. Ever since the turn to neoliberalism and beyond, we have seen a situation where the process of degrading healthcare has accelerated. That link is so clear and so obvious. Poverty itself is not just like health inequities. Poverty itself is not just some aberration or some mistake or some incidental result. There is a role for poverty in capitalist society. There is a need, if there is going to be economic coercion within the system, to have a segment of the population that lives in poverty. And there was a period when merely straightening people's circumstances, introducing some increased levels of hardship was enough. But during recent years, it has gone over to a level of complete abandonment. The Association of Municipalities of Ontario points out that homelessness has skyrocketed over the last few years in Ontario, and they are talking in terms of within a decade it tripled. It's an absolutely appalling situation. But the abandonment of people on the streets is profoundly linked to the degrading of the healthcare system, which itself in many ways is the ultimate act of abandonment. And so this book challenges that. It names the capitalist system itself in detail, in clear ways, and shows how it's responsible, and it advances a frankly and clearly socialist alternative that is so incredibly valuable. But at the same time, It is not a book that deals in dogmatic pronouncements from the sidelines. It doesn't just offer some smug critique about capitalism and leave it at that. It looks in detail at the methods of struggle, the points of contact, the chokeholds, the way in which we can actually engage this system, and we can fight in the here and now for changes that really make a difference. I just happened to see that Doug Ford has just announced a further increase in privatisation within the healthcare system. So this is not an abstract question. This is a living struggle that is going on as we speak. And they will take it further and further and further in the direction of abandonment. And communities are going to have to organise, they're going to have to fight back. There are many roles to be played by healthcare providers themselves. There are many roles to be played by those who need healthcare system and by communities that are on the front lines. And so this book is a rallying call. It is a source of invaluable information. It is enormously valuable. It comes from the heart, but it produces a level of analysis and clarity that's incredibly valuable. So I thank Arnel so much for this wonderful book, and I look forward to using it in the struggle that lays ahead. Thank you very much.
Thank you, John. That was excellent. Thanks very much for that. So finally, before we move on to some Q&A here, we're going to turn it over to Freida Chavez to finish this off.
Thanks. I'm so honored to celebrate this book of Arnel. I want to share some reflections, particularly through the lens of the Alliance of Filipino Nursing Professionals in Canada. You can't hear me. Okay, I'll use this. Yes. Thank you. We are very proud of Arnel, a courageous voice, a thoughtful scholar, and one of us, serving as a regional representative of AFNPC. While tonight is the first time Dr. Borras, I call him, and I are meeting in person, we've had numerous meetings over the year, thanks to the unexpected gift of virtual meetings that COVID taught us. And many of these conversations are grounded in the very work that we are celebrating today. His bold and necessary critique of how health inequities are produced and maintained. In his book, Arnel challenges us to understand neoliberalism not just as an economic theory, but as a logic that now shapes how care is valued, delivered, and even denied. He doesn't just talk about gaps in policy or funding. He goes deeper, naming the systems, the ideologies, and power structures that drive health inequities. One of the most important questions Arnel raises is, who gets left behind and why? Sometimes to answer that, we don't need to look at policy reports, we just need to look around the waiting room. Let me share something personal. My husband and I recently had cataract surgery, something many people our age face. You'd think in Canada, with our public health system, it would be simple. Instead, we face a maze of confusing options. This lens is covered by OHIP, this one isn't, basic lenses are free, other lens costs more. Pretty familiar? It didn't sound like care, it sounded like a sales pitch. And it was not just us. In the waiting room were all kinds of patients, working class, newcomers, older adults, all being told different prices, different options. You could see confusion, even embarrassment on people's faces. This isn't what public health care should feel like, should it? This is the very kind of everyday injustice Arnel names. When healthcare is reframed as a commodity, where what you can afford matters. And worse, neoliberalism teaches us to see health as a personal responsibility. As though poor health is about bad choices. not about racism, unstable work, or credentialing barriers. Filipino-Canadian nurses know this firsthand, and we have some of them in the room. We are present everywhere in care, overrepresented in numbers, yet still underrepresented and often invisible in leadership. We are praised for our hard work, our bedside dedication, but our credentials are often not recognized. We work in precarious roles without pathways to decision-making, research, academia, or leadership. We've heard too many stories. Nurses afraid to speak up, talented colleagues overlooked, a growing sense of isolation despite everywhere in care. This is not a diversity problem. It is a structural problem. Neoliberalism says, be resilient. Arnel says, no, systems must change. As he so powerfully reminds us, inequities are not accidental. They are embedded in structures, ideologies, and systems that decide whose voices matter and whose do not. While our focus at AFNPC is on Filipino-Canadian nurses, we know the struggles are shared by many other racialized and marginalized communities in healthcare. What sets our experience apart is this. We are trusted to care for everyone across cultures, conditions, and communities, but rarely trusted to help the shape. We are not trusted to shape the very system that we work in. So the question isn't whether we belong at the table. It's how much stronger and more equitable could our health system be if we are included and if our voices are truly heard. It is precisely the lived experience that holds the insight, the compassion, and the clarity to help shape a more equitable, effective health system. And that brings us to one of Arnel's most powerful calls. We cannot do this alone. Our struggles are connected, and so must be our solutions. Across sectors, health, education, labor, civil society, we must build movements because we are stronger together. At AFNPC, we hear that call. We are building bridges across provinces, across sectors. We are organizing not just for inclusion, but for structural change. So Arnel, thank you. Thank you for giving us the language to name what we live and the courage to imagine something better. And to all of you, thank you for listening, and thank you for being a part of this growing movement.
Thanks, Freida. That was wonderful. That was a nice way to kind of bring it all around, I think. So we have a little bit of time for Q&A if anyone has questions.
My MA is on health policy and equity, as well as my PhD is on health policy and equity, and we studied all these terms. And my supervisor is here, Dr. Dennis Sharpe, and we have courses on political economy of health inequities. And we have various other theoretical lens, like intersectionality and so on and so forth. So I guess the names, the names of capitalism, racism, sexism, ageism, and ableism, and many other kinds of ism and systems, social systems, power imbalances are our day-to-day conversations inside the classrooms.
and as well as Dr. Joel Lexin is here also, who is also my professor in the influence of big drug corporations in the society. So these are as if natural conversations in our school. So I really don't encounter pushback when I'm doing this to really name these isms. But my personal struggle, of course, is the contentious debate on these three major isms: classism, racism, and sexism, because this is very contentious until now. So that's why I'm very careful on taking a look at these, because sometimes it could be very divisive. But when I do my research, and careful research and so on and so forth, I come to believe, based on evidence, that it's really capitalism that is the fundamental driver of health inequities, and that racism and sexism, which part and parcel of capitalism, exacerbates health inequities. So that's why I really am Genesis here. So.
I'm really surprised because my interviewees are not homogeneous. They're heterogeneous. They come from very different backgrounds: sociology, physician, nurses, John Clarke from community groups, activist groups. So, what surprised me most is they explicitly named capitalism. Capitalism, neoliberalism. I'm not expecting that because I'm anticipating they will say political economy systems. I also expect some will focus on sexism and racism because some of my interviewees are also from people of color, and I'm sure there is one Métis, which I think I can name because. She did not say anonymous, and is the president of ECI. And although she did not name the systems itself, the way she describes it is all about classism, racism, and sexism, and the influence of power asymmetries. And she mentioned corporate influence and so on and so forth. So it's really, I really could not, I did not invent what is this. It's just most of the analysis that comes from the excerpts and thematic analyses of those interviews. So it's really in there, and I just selected a few excerpts in here because the book is limited in words, but if you can see my dissertation itself, because I need to preserve all those brilliant ideas, it's more comprehensive. I almost put everything that they said in there, word for word.
And it's remarkably reassuring for people like us to realize that we're not nuts.
Well, that's wonderful. That's a nice teaser in a way, I think. Buy the book, buy the book. Okay, well, I think that's all the time we have for tonight for the importantly, I think a round of applause for Arnel and all of our panelists. So that's just about it. So please do feel free to stick around. There's food in the back, there's books to look at.